Hi, do you know about PCOS? Well, basically, the real name, it's called polycystic ovarian syndrome, and it is what it sounds like exactly. Poly meaning many, cystic meaning cyst. Put those two words together. So it's a many cysts that are on the ovaries. Let me tell you a little bit about myself before I, you know, start to break down more about polycystic ovarian syndrome. Okay, basically, I started my period, my menstrual cycle. For all the guys who listen in, they probably don't want to hear that word, but I'm just going to stick with my cycle. When I started my cycle, I was irregular until like almost it was non existent. So I'm thinking to myself, my friends, family, classmates that were women, they were always getting their period at a normal basis, like either 28 days or what have you, monthly. Whatever it was, I knew that they were getting theirs regularly and I was not getting mine regularly. So I felt depressed, hurt. I felt like I was all alone. And for surely, I felt like I wasn't normal. Was going to the doctor and he said, "Oh, well, some women they get it like that, but when she gets older, she'll start getting it." But that was a lie. It almost, like I said, became non-existent till like one day I was confronted by an older person that I knew, an older young lady that I knew. She was experiencing polycystic ovarian syndrome, and she looked at me and she said, "You know what? You may be experience the same thing that I'm experiencing. Why don't you tell your doctor to check you for that?" So I did, and I was like so relieved. I knew that I had something, at least that I had a name for it, and it was called polycystic ovarian syndrome. Okay, now let's talk about polycystic ovarian syndrome. Okay, a person that does not have polycystic ovarian syndrome, this is how they start their ovulation out. Okay, it starts out as a follicle. Now the follicle grows into an egg. In the egg, many eggs, and the egg is just a set, like a little storage until fertilization. But a woman with polycystic ovarian syndrome does not meet the same fate. Basically, her follicle doesn't grow into an egg and store up. It just grows into many cysts. So, ladies, do not get alarmed. This is basically not cancerous. Not saying it's 100% not cancerous. More than likely, you will not incur cancer. Okay? So, like I said, she doesn't meet the same fate. And with this disease, it cuts down. We're just going to say, for layman's term, it cuts down mostly of all of the women hormone, which is called estrogen, as we know, and it produces the the hormone testosterone. Well, we ladies know what testosterone is. That's a male hormone, and that will cause us to start having unwanted facial hair. It also will cause you to break out acne, thinning, balding, all the unbeautiful things that us women prefer not to deal with. And we have hyperpigmentation on our skin. So you're basically saying, okay, so and the egg does not fertilize, and you're saying, well, can I have a baby? I've known women that have. Well, I know one woman personally, one lady personally that have had a child with that syndrome, PCOS, and there's other women out there. Just look it up, and you can see. You basically almost could look at a person with PCOS. They're childless, may have unwanted facial hair, and they might be weight, challenged, overweight, basically, and basically our sugar doesn't process the same. You know, like when you eat fruits and when you eat your fruit, that's considered good sugar. But with somebody with a PCOS, doesn't the body doesn't decipher whether it's good sugar or bad sugar. So therefore, even when you eat the good sugar, it's still counted as bad sugar. So what you can do to, cut down on the risk or whatever or the symptoms, uh, you just really have to just try to monitor your weight, and eat right and exercise. I know you're looking at me. It's been hard for me, but I'm here to help somebody else that wants to deeply, you know, encourage them to have a child, to live a healthy lifestyle where they're not dealing with the PCOS symptoms. I know because it gets depressing and also it does cause depression, okay, and irritability. And those are signs that I've had. And I'm pretty sure you're saying to yourself, you know, why am I feeling this way? It's because your regular hormone is not doing what it's supposed to do. What's supposed to clear your body. And it also has to do with our psyche. So there are replacement therapies that we can do for that. And if you want to have your child, just consult your doctor and, let him know you're concerned and he will help you out. Okay, this is Lisi, and I'm glad that you watched. And also, don't forget, September is PCOS Awareness Day. I missed it. I'm wearing the color teal and everything, but I didn't do it intentionally. But this encouraged me to make this vid for you. I hope you enjoyed it. Love you. Take care.